first, I want to say good afternoon to all participants. So this is our weekly update. So far, we in Clark County have administered more than 174,000 doses of vaccine, both Pfizer and Moderna. I also want to share with you that recently we start offering the second dose of vaccine, and those second doses are being offered at Las Vegas Convention Center for all those individuals who received the first dose at a facility that have been managed by the Southern Nevada Health District of the county. And this is basically our facility at 280 South Decatur Boulevard, also Western High School, and Cashman Center. Those are the facilities where people who received the first dose back in January now will be able to receive the second dose at the Las Vegas Convention Center. Regarding vaccine allocation, as we mentioned last week, and still is the issue, our vaccine allocations are very limited right now. We are receiving somewhere between 25,000 doses of vaccine per week, and we expect those numbers to increase in the near future. But that's what we have right now, and we are working with our local partners based on those numbers. Regarding the coronavirus pandemic, in Clark County we have more than 200,000 cases reported so far, and unfortunately more than 3,000 deaths. This is something that has heavily impacted our community. Last week we notified the first case of the B117 strain, which is the virus strain first identified in the United Kingdom. And now this week we received a confirmation from the lab that 5 additional cases of this strain have been identified here in Clark County. The important thing about those 5 additional cases is that all those are close contacts of the initial case, and this really shows the value of contact tracing and how hard our investigators and partners have been working on trying to identify close contacts of the cases that are investigated. So at this point in Clark County, there is a total of 6 cases confirmed by this strain. And this is something that have been reported in multiple states across the country right now. I also want to share with you that starting today, we will be reporting in weekly basis the places of possible exposure. And it's important to emphasize the possible exposure here. Because this is based on information collected through our contact tracing investigation, and this is specifically when we ask a case where they have been the last 14 days, and then they identify certain public places where they have been. So any particular case could identify multiple possible places of exposure. In other words, a place of possible exposure is not synonymous of place of exposure. So by identifying a possible place doesn't necessarily mean that the person was infected at that place, but we take that information just to expand our our investigation and look for more elements into the decision making of how to manage cases here in the county. I will stop here and I will invite our Commissioner, Marilyn Kirkpatrick, please.
Thank you, Dr. Legon, and I apologize. I have a standing meeting once a month that I do within my district, and so I won't be able to stay on, but I do want to emphasize that, you know, it's been more than 174,000 vaccines, as you said, in a short time. And I encourage the public to be patient with us. This is all new to all of us. And I encourage the press to help us get through some of this rocky times, right? It's hard. IT systems are up and down. We're trying to work through that. We're trying to get some clarifications for everyone. The call center, we've made some clarifications to the call center this morning. So we encourage people to be patient, to work with this. Nobody wants to get the vaccines out more than the Southern Nevada Health District because we know how important that is to our community. But it is we are gonna have some rocky moments. So remember that anytime we do something new, we have some rockiness. But I think Joanne will explain to you that they'll be sending out emails to the people that were first getting that dose. I think she'll explain that to you. I think Chief Steinbach will be able to tell you how we're ready to go in the event that we get a lot more vaccines. I think Councilman Black will be able to really tell you that the health district is focused and working together several meetings a day to stay on target. And lastly, I just want to acknowledge that Dr. Legon is our Chief Health Officer, and we couldn't be prouder to have someone with the experience who has led us through this. And apologize, I can't stay on, Dr. Legon, but if there's any questions, I'm happy to meet with anyone. But remember, we're a collaborative team from the state to the local jurisdiction. We all work together, and we all have one mission, and that's to get as many vaccines into the arms of folks that need it and to safely keep our community going. So thank you, Dr. Legon.
Thank you. Okay, thank you, Commissioner. I will invite Councilman Scott Black. He is the chairman of our Board of Health. Scott, please.
Thank you, Dr. Legan, and thank you, Commissioner Kirkpatrick. She's done a tremendous job as a co-leader with Dr. Legan on this effort. I really appreciate all that she's done. Just like she mentioned, I personally know, and I know everyone at the Health District is fully cognizant and aware that there are many people in our community that are frustrated because you're unable to get the appointments for the vaccine right away. I know in a perfect world, we all want to know exactly when, exactly where, and exactly how we will be able to get vaccinated. But I hope you will all bear in mind and think it's important to remember that we're literally building this infrastructure to deliver the vaccines at the same time that we're receiving the vaccines to distribute them. We're only able to provide the vaccine. It's also at the rate that we get them. So we've built tremendous capacity. Chief Steinbeck and all of the emergency managers have done a tremendous job building the capacity. And the good news is we are weekly getting vaccines. We're getting supplies every week, and we're hopeful that that vaccine allocation will increase over the coming weeks. And as it increases, we are certainly capable of utilizing every one of those doses in our community in a pretty expeditious way. I just want you to know that at the Health District, we're committed to providing you updated information as soon as it comes available, both through media releases and as well as this weekly media access that we provide. Also, the Health District is working diligently to provide services at the highest level. We're trying to improve as we go. We're literally on the vaccine train. The train is moving down the tracks. We're building momentum, but we're also simultaneously building the tracks right out in front of the train as we go. And so thankful for the patients, thankful for the media to help us get the word out, to talk about locations and vaccine availability. And we're all going to collectively continue to do our best to get vaccinations to everyone in our community who desires. Dr. Legan.
Okay, thank you, Scott. Thank you. Okay, I will ask Joanne Ripaper. She is our Chief Administrative Nurse and also leading our vaccination campaign. Joanne, please.
Joanne, let's get you unmuted.
Thank you.
Okay.
Good afternoon. So our vaccine campaign has been maximized every week that we've received the vaccine. We are getting about 23 to 25,000 per week in Clark County, and we are using that every week. So I think the number 175 about is a very satisfying number. We are focusing still on the same tiers, the over 70 group, the frontline community support, up to continuity of governance, and we are really focusing on education this week, and we have some strategies for that. We also are fine-tuning our appointment scheduling system so that when individuals are getting vaccines today at Cashman, that they have a notification of either email or text that they can get their appointment right away. So we're still fine-tuning that a little bit, getting that set up, but it's getting better, much, much better every day. So that's all I have.
Okay, thank you, Joanne. Okay, I will introduce now Chief Steinberg. Chief, please.
Thank you, Dr. Ligon, and publicly I'd like to say congratulations. We're very happy that you're our full-time doctor in charge of this now. Thank you so much. And congratulations. All I'll say to this, sir, is we're ready to maximize our operations. As Councilman Black said, we're ready to push out more vaccine. We just need more supplies. We have many more sites that are ready and able to be opened up. Today's our first time that we've opened up a site down in Laughlin to serve that community. But throughout all of Southern Nevada, we stand ready to open up many more sites and to maximize the sites that we currently have open to get this community vaccinated and as back to normal as we possibly can. So we stand waiting, and I await any questions that you might have.
Thank you, Chief. Thank you. Okay, Cody, would you please go now to the questions?
Certainly. Let's go on and open the floor for any media to ask the questions. Please use the raise hand feature. Spanish language we'll save till the end with a special session with Dr. Ligon. First up today is Jacqueline Schultz from Fox 5.
Hi, everyone. Thank you all so much for, I know for the past few days, you all have given more clarification on second doses and figuring out the appointment system. A lot of viewers are calling with this question, just as a practical, for some seniors or other essential workers, if your second dose is coming up and you still can't get an appointment, what are your options? Should you Las Vegas Convention Center and explain your situation? And if you could give our viewers some guidance on like what's your time frame window for when you need to do so and get your second dose. We know Pfizer 21 days, Moderna 28, but is that what do you need to do if you're in a time crunch?
Okay, first I would tell you that the CDC recommendation for the second dose is yes, 21 days for Pfizer and 28 days for Moderna, and then there is also a time frame of 3 to 4 days even after that day. But the recent CDC guidelines considerations also point out to the possibility when a person is unable to get the second dose just within that original recommended time frame because of many reasons could be there. they consider that it is still acceptable and effective to get that second dose between the first 6 weeks or 42 days from the initial dose up to the second dose. So those are the current CDC recommendations, which keep the original time frame of 21 to 28 days as the valid one. But the consideration for people who might miss that initial opportunity, they still have up to 6 weeks to complete that. But I will ask Joanne to talk about second dose appointments and what's going on here and what we are doing to address that. Joanne, please.
Again, okay. The second dose appointments as of January 19th, 18th, somewhere in there, we switched our appointment system. Prior to that, we used an online system. And so with that, we will be emailing individuals and giving them the link for them to make that appointment. When we did that and when we published it on our website, it really overwhelmed the system. So we are fixing that by sending it out again and giving an opportunity for those people to make appointments. So if you've had your vaccine from January 4 to like the 19th, we will be emailing you for that. For the other, when we went to online registration where you would actually give your birth date, all the demographic information, after you vaccinated, you would get a link that would give you the opportunity to make an appointment. We had some technical problems with that, and so we do have a link open on the website so that people are able to make that appointment. And we can send out some more information about that. So keep in mind that our clinics, we need to open them yet. You should check back in a day or two and either schedule or reschedule, and then call 702-759-1900 to, if you still have problems, then to go to that website and they will assist you.
Okay, thank you, Joanne. Thank you. Corey, please.
Next question is from Megan Messerly. Unmuting you now.
Hey there. Thanks again for doing these every week. Kind of bouncing off of that last question, just to clarify, I've been hearing from some folks as well, who've told me that, they wanted to get their dose, 21 days out, 28 days out, exactly on the day they were able to get it, and they haven't been able to make those appointments. And then, they're clicking around other days and seeing those are full. So based on your last answer there, Joanne, is the hope that everyone who wants an appointment 21 days or 20 days, whatever their allotted time is, will be able to get one on that day? I understand that, they can get it, later if scheduling conflicts or what have you, within that period. But it seems like based on, when they got their first dose, the state knows when they got their first dose, those doses are ordered based on that schedule. So it seems like people should be able to get doses on that date. So with these corrections and the emails and everything you're talking about, should everyone who wants an appointment on that first possible day, they can get their second dose, be able to get one that day?
Correct, or close to it. Like Dr. Ligon said, there is some grace period with that, 3 to 4 before it, and then after up to 42 days. But typically, we would want to get it on the same day. We only used Moderna up until around January 8th. So it should be at the 4-week, the 28-day time frame. That's good information to have for individuals. And they have to have gotten the vaccine with us. So as I've discussed before, is that every vaccine provider gets the first dose, and then they order 3 to 4 weeks later, they can order that second dose, and they can only order that amount. So last week we ordered 9,200 for this week, and we know that that's how many we had because we are able to take it off of our electronic system, and so that's how many appointments we made. So there were some individuals that were making first dose appointments at the Las Vegas Convention Center. Not a good idea. We won't be able to take you because then we will be taking a second dose from someone else. So we are not doing that. We notified people that they should try to get on the website and then get that first dose. So, and if you get your vaccine at your employer or UNC or UNLV, any of the other partners, you're going to need to go back there because, again, we don't have your dose on hand for you. If people come from out of state or something like that, then they can call us and we can try to assist them.
Next question is from Mr. Joe Moeller.
Hey there, Joe Mueller from Channel 8 here. I have a couple of questions. I am currently working with a woman who told me that she went on to make an appointment and the website keeps crashing and she's worried she won't get to her second date she's supposed to get it by. And she had called the health district and they told her they won't be sending emails anymore. She said that was a change as of yesterday, and she's a little bit confused, and I'm sure there's others out there like that as well. So I don't know if we get some clarification on that.
Correct. So we did send some emails out. We sent it out twice for the first round up until people that received their vaccine until the 10th. And now we're going to send another one for that next group that got their vaccines through the 19th. After, if they went through the clinic and they had to give all of their stuff electronically, like birth date and all that, then they should have received a text and email directly to their phone afterward. So, so if they have trouble, they should try to call us. Yes, we've had a lot of phone calls. We just got more capacity for people to answer the phones today. And it's changing every day, and you know, we're trying to work through these issues so people can get through to us.
Perfect. And real quick, the Laughlin location, I noticed this morning there was substantial openings this morning. If you go to Laughlin, are you going to end up getting your second dose up in Las Vegas?
No, Laughlin is only first dose.
And it's only Laughlin residents, or is it anybody in Clark County?
Well, we targeted, I mean, we obviously advertise for that area. There really isn't a residency requirement. So, but we do encourage communities to reach out to their community members so that they can receive that vaccine appropriately.
Thank you.
And I would like to say too that, like you said, if people make appointments, they should keep them. If they're not eligible or they change their mind, please cancel so that we can get more people in, and please don't just not show. It's very disheartening to see that we have a less of a crowd because people didn't cancel appointments or did them inappropriately.
Next up is Ms. Mary Hines.
Thank you and good afternoon. Sorry, but I am unclear on what the guidance is for people who have been unable to schedule these second appointments. Are they just to keep trying on the website, and are you fixing the website? So if at such a time as they are due and they still don't have an appointment, should they just show up at the convention center?
So it really depends when they got that vaccine, okay? So if they got that vaccine somewhere between January 4 and the 10th, I know it sounds so complicated, but we had a lot of issues. So up until about January 10th or so, we sent out 2 emails, and opened up the appointments, and they did have opportunity to get it then. We're sending out another email for those through January 19th, and they will have an opportunity to get an appointment, and that should go out today or tomorrow. From then on, when they were on the electronic system, we are working on that. So they're not due till February 19th. So they may not be able to get an appointment right now, but they will by the time they're due.
Yeah, you also want to mention that we have a phone line where they can call the problem.
Right.
Yeah.
Next question is from Mr. Michael Davidson.
Sorry, I had to get myself unmuted there. Thank you for taking my question. I had a question about the possible exposure location data that began being published on the Health District website today. So back in September, many months ago, it seems like another lifetime at this point, there were reports of possible exposure locations being published by the state that the Review Journal and other news outlets obtained through a public records request. The state stopped publishing those. We asked the Health District if they would continue to do that analysis. And at the time in September, we were told by a Health District official that the reports would, quote, provide limited, if any, value while we are experiencing community spread of the virus, end quote. Now, obviously, the Health District is starting today publishing this possible exposure location data. And I'm just wondering what's changed. Is the SNHD finding more value in this data right now and getting it out to the public? How should the public use this data in their day-to-day lives, if at all, when they're considering everything that we publish and make public? And what is the SNHD doing with it internally to shape their COVID response?
Sure. Thank you, Corey. I will take this one. Well, as we said before, this data has a limited value. And the reason for that is because this is a disease that has a relatively large incubation period, is up to 14 days. During that period, people who become confirmed cases have been at multiple places usually, and when they identify a possible place of exposure, or what we call the possible place of exposure is we are referring to public places that people tend to remember the most, but not necessarily means that the person was actually infected at that site. So that's the limitation of that data, that kind of information. Now, why are we posting that information? Because we are receiving so many calls, people asking for location, that kind of possible exposure, and we don't want to submit our team to the stress of this, oh, sorry, this is sorry. I'm really sorry. So we don't want to submit our team to the continuous stress of creating report that they're being asked for the same kind of information. So a way for us to actually save time for our team is to post that information. So if anyone has an interest in that kind of data, is available at our website. Having said that, we use that information also with our environmental health division, our inspectors, and we share that with them. And if they find any kind of trend on certain locations, they might decide and go and do inspections, communicate with people on those places. So this is the way that we manage that information, but we consider that for the general public, it has some information, but really limited in terms of being able to make any conclusions from that data. Thank you. Got it.
Before we move further, let's, Mary wants us to circle back. You said there's a phone number that people can call regarding second dose appointments. Can we please give out that phone number and explain who should be using that number?
Yes, I'm just going to confirm that and I'll put that in the chat.
Thank you, Joanne. Our next question today comes from Alexis Gorey. Unmuting you now. Trying to.
How about there? Can you hear me now?
Yes, ma'am.
Okay, hello everyone. Kind of a two-part question here. So with the error that people are getting trying to make appointments right now, is that just a capacity issue? Is the website, shut down because too many people are trying to make appointments? And also, how many vaccines did we get this week versus how many we were told we were supposed to be getting? And if there's a difference, why?
Joanne?
So you're talking about the number of vaccines we were given versus, I'm sorry.
Yeah, she's asking two things about what might be happening with the registration system, what people struggle to get an appointment.
Okay.
And also, what is the difference between our vaccine allocation this week compared to weeks?
Oh, yeah. Okay. Yes, our vaccine allocation has been the same, and we expect it to be the same next week. We just received that news today, and the registration system, it's more complete and more. It gets them ready to go to the clinic, I would say, so that it takes a little bit longer, where we're asking questions about your date of birth, demographics, and your health status. So it's a little more complicated than it was before. So if people need their first dose, then they should keep in mind that we only set up the appointments 3 days in advance for first dose, so they should check every day, and the reason we have to do that is because we don't know what kind of vaccine we will be getting. So typically we get our shipment on Monday, and we have our clinics later in the week, and then we do some adjustments, and then we really know for sure how many appointments we can do. For example, we had some clinics scheduled this week, and now we increased the capacity, so now appointments opened up. Does that answer your question, I hope?
Yeah, I think it does. Thank you.
Okay.
Cody.
Our next question is from Fox 5. I'm unmuting you right now. Let's see if this works. There you go.
Hello, can you... Hi. Can you hear me?
We sure can. Please go ahead.
Thank you. Okay. From Fox 5, and the questions I have are if you could maybe talk about the demographic breakdown of who's received the vaccine so far. I think that's been touched on before, but we'd just like to get some on that. And then a second question I had was if you guys know when we can expect another lane to open up or another lane to be added to the groups of eligible people to get the vaccine. Thank you.
I do, Dr. Ligon, I do have that.
You have that in front of you? Good.
Yeah, I do have it in front of me, actually. I was just looking at this today. We had received it. This is for Clark County. Yes, for Clark County. And so it's 174,665. And we have a race and ethnicity of 40% white, and we have 16% unknown and 16% other, 11% Asian, 10% Hispanic, and 4% Black or African American. And then our female group is doing a little better than the males, I would say. They're at 58% and males are 41%. Age groups, we have a 42% of above the 65 plus. That I know we're doing 70 plus. I think that just is in the way that it's reported out, but probably why the 65% or 65 plus is that there is, individuals who are working still at 65 to 70. So, and 9% were unknown. So I don't know. They didn't know how old they were, I guess. It's probably because we didn't get the date of birth or things like that. The next biggest group was 28% of 25 to 49. And I'm not surprised by that either, because if you think about it, we've been doing a lot of, first responders, law enforcement, medical, those individuals. So yes.
Okay.
Next question today comes from Dana Gentry. Unmuting you, there we go.
Hi, thank you for taking my question. What are you doing to address the data that you just discussed about the demographic disparities, specifically for Hispanic and Black populations?
Sure. Thank you. Well, what we are doing, or I would better say what we plan to do, because these are two different things. What we have been doing so far with our vaccination sites, we have been utilizing mostly large vaccination sites, Cashman, the high school at Western, and also Mac Middle School. All those facilities are located within or very close to the zip codes where we have our highest incidence of COVID. Now, we do have the distribution of people who have been vaccinated by zip code, and when we map that distribution of people who have been vaccinated, actually it doesn't match the zip codes with the highest number of COVID cases in Clark County. And there are perhaps a couple of reasons for that. One is that the initial groups that we vaccinated, well, healthcare workers and law enforcement and other groups, they are widely distributed through this community. But also the issue that regardless of where you locate a mass vaccination site, people will register from any area in the county, and they will actually drive there. So in other words, we have, for example, the high school at the Mac Middle School, which is in the East Las Vegas. It doesn't mean that only people from that area register. Actually, it's very possible that a lot of people who live in other areas of Clark County register to those sites. So this is what we have been experiencing, and the way that we are looking to address this issue of access and also, of course, inequalities is to move in a different direction in the near future and start deploying a small vaccination sites or strike teams in those zip codes in partnership with local elected officials, community-based organizations, and groups that are highly respected on these areas. So we can ensure that if we allocate 1,000 vaccines to zip code X because we want to make sure that we are targeting that area, those 1,000 shots are actually administered to people who live in that area. We understand that everybody needs a vaccine, and being vaccinated is important for each resident of this community. But also, we are aware that there are certain areas of this community that are being heavily affected by the pandemic, and we need to specifically target those areas to make sure that we decrease the rate of transmission in those areas. So that's how we are planning to do this, because certainly we cannot rely on just the mass vaccination site being located in that area, because it doesn't guarantee that people in the heavily affected area will get vaccinated there.
We're going to take one more voice call today. This one's from David Charnes. I'm unmuting you now, sir. There you go.
Thank you. Thanks. And thank you guys for taking our questions today. I wanted to circle back and follow up on Michael's question about the data that is starting to be posted today regarding possible exposure data. As he mentioned, obviously this is something we have been asking for months. The last data was released in September. Several of my public records requests about this have been denied as recent as 2 weeks ago, when I received an email back from your legal department that said, quote, we are not able to make a determination where an individual obtained COVID-19. Over the past several weeks, I have gone back and forth with the communications office and the legal department, basically going over semantics on what I was looking for, and then all of a sudden today the data is posted. So I'd like to know why today it was decided to post this exposure data when we are now almost a year into this pandemic, and it seems like we had this data all along. Thank you.
Sure, thank you, Corey. Well, I believe I referred to that before, and I will say the same thing again. We are posting this information because we are receiving a lot of questions about site of exposure, which we call a possible site of exposure. We don't want our team to be submitted every single week to work on those kind of requests. So a way to address that is by posting that information, making that information available, and that's the decision that we make, and that's the reason why you are seeing that information there. I cannot comment on your interaction with our office in previous weeks, because I'm not fully aware of what that interaction was, so I will just leave. But we made the decision to post information so we don't receive that many requests for that kind of data. Thank you.